Alphabet soup. Never thought I was going to be using that for something else, and it's the open enrollment for the U.S. healthcare plan. So newcomers are so confused, and I don't blame them. So we're going to do a little bit different style today. We're going to have a discussion about the healthcare plans and what they all mean. I'm Brenda.
And I'm Leon. Welcome back to our channel, Life with the Jacksons.
And we're here to share our story and to help everybody make decisions. And healthcare is one of the top decisions that you need to know the answers to when making your choices for your healthcare plan, because it is quite different from in Canada. So let's get at this.
Yes, actually, usually in October, as Brenda mentioned, it's open enrollment season here in the U.S. for your medical insurance that you need to choose as you roll into 2026.
There's only one time a year, and this is it. Otherwise, there has to be certain circumstances to enroll into another program or health plan that is not necessarily that many options for you. So we had that experience doing that ourselves when we first came here, because it was in July. So it was a little bit different for us. And then when Leon was able to get his permanent residence and his employment secured, then he had some choices to enroll for life change event. So for the first question of this alphabet, what's the difference between the PPO, HMO, and the HDHP plans?
Yes, the alphabet soup. It is confusing for a lot of people. So the PPO, also known as the Preferred Provider Organization. This is the most flexible of all the plans. It allows you as the patient to pick and choose who you want as a doctor, your specialist, and you set and make your own appointments.
Now, do we have that plan?
We do have that plan through my employer. Yes, we do.
And we do pick our own doctors, and one of them is a network and the other one's not. So you have that choice. So it is flexible, but it gives you that option to choose your own specialist.
That's correct.
What about the HMO?
Well, the HMO is the Health Maintenance Organization. Basically, it's the opposite of the PPO, where it's incumbent upon you, the patient, that you stay within your network. And you don't have the flexibility as much as you would have in the PPO. If you do have the option to go out of network, but then you're paying more out of your pocket as well.
So it probably, you still have a choice, but the cost is going to be out of your pocket.
Correct.
More so.
Yeah, more out-of-pocket expenses with an HMO.
And what about the HDHP?
HDHP, high deductible health plan. There's lower premiums with that one. You have a higher deductible, and we'll get into what deductibles are further on in this discussion. And it's often paired with what's called a health savings account.
I like that one.
Yes. Yeah, we have that one as part of our plan with the PPO.
Now, are we going to explain a little bit about that later on, or did you want to go into it now?
No, we'll go through that later as we get into some of the other topics.
What's the deductible, copay, and coinsurance, and how much will I actually pay is one of those questions.
Deductible. Well, think of that as if you have car insurance and you get into an accident, you have to pay a deductible in order to have the insurance fix your car. It's no different in health insurance. Each plan has what is called a deductible, that when you're going to visit the doctor or get prescriptions and stuff like that, you're paying upfront for those costs, and those costs go directly to your deductible.
Similar to if you have healthcare plan through your employer or individually owned healthcare in Canada that you're paying out of pocket or benefits, you have a deductible most likely.
Yeah, and then once your deductible is fully paid, then your insurance will fully cover those expenses for you.
So that's a no-brainer. That's easy peasy. So what's the next one?
The copay?
Yeah.
It's basically the flat fee that you will have to pay to go visit a doctor, and it's usually not a lot, 20, 30, 40 bucks depending on your plan. And there's also flat fees for prescriptions, and those also will be directed right to your deductible when you make those payments.
Okay.
Yeah.
Now, what about the coinsurance?
Coinsurance. So once your insurance kicks in, there will be something called coinsurance, and basically it's a percentage. If you have a 90-10 copay, your insurance will cover 90% of the cost, and you'll cover 10% of the cost of whatever prescription or visit that you have. And that's the most important thing, is to choose the plan that's appropriate for your family and your situation.
Because one of the plans might be a little bit less than the other, but you have to look at the big picture. You are going to pay out of pocket for health care here because you're paying less taxes. You have to budget that in because it's going to happen.
Correct. And then there's something also called an out-of-pocket maximum. Don't ask me what that out-of-pocket maximum is, because it varies based on whichever plan that you have.
Yeah, for example, ours is, we have a maximum that we'll pay out a year for the whole family. So if one of us got really sick and in the hospital, needed heart surgery, and we were in the hospital for a week, and the kids ended up getting, breaking an arm or something, what is the maximum that we'll pay?
I believe, if I recall, our maximum was $6,800 for the year.
Max.
So there's an individual max and then a family max. And once you hit that family max, it basically covers the entire family for whatever visits you have. And the individual maximum actually goes and gets applied to your family maximum. So it's not like you have to double dip or double pay anything. The deductible is the deductible, whether it's individual or family. There's no universal health care here in the United States. If the Canadians are shocked, I think most Canadians are aware of that.
This is another question Canadians were asking. Can I keep seeing my doctor, my Canadian doctor, or use insurance while visiting back in Canada?
You won't be using your U.S. health insurance to do that, that's for sure. I mean, if you want to continue to see your Canadian doctor when you visit, go right ahead. But you'll need to travel with, travel insurance when you're visiting in Canada, because generally the U.S. Health insurance packages that you have are for U.S.-based healthcare only.
And I think too, if you're going to go and you want to plan to go see your family doctor in Canada, it's almost similar to paying for a functional doctor or a holistic doctor when you live in Canada. You might have to pay out of pocket for it.
Yeah, absolutely.
So, it's here or there, but if you're really comfortable with that doctor and you still want them, then hey, it's your choice.
Yeah. It's almost like vacationing. If you're going to vacation somewhere, you usually have travel insurance.
Yeah, but it won't cover if it's a scheduled visit. So,
Okay. So maybe we'll edit that part out then.
How do I add my spouse or dependents, especially if they don't have a U.S. Social Security number yet?
Well, this is a concern for newcomers that are coming into the U.S. from Canada. Typically, employers, you can work with your employer. They can come up with a temporary ID for you to get your dependents added and your spouse added. But it's incumbent on you to make sure you contact your HR department of your employer to try and get that taken care of as quickly as possible while they wait for their government documentation.
What happens if I don't choose a plan or miss the open enrollment deadline? Very important that you do not miss the deadline.
Yeah, that is true. You cannot just sign up for health insurance anytime in the United States. Typically, it's like we said right now in the month of October for most employers. In certain circumstances, though, it has to be technically like a life-changing event. You're either in the middle of a move, maybe you got married, or some other life-changing event happened. Yeah, stuff like that. Then there are some exceptions where you can get the medical insurance that you need for you and your family.
We mentioned that earlier, that when we moved it, we weren't in the open enrollment, and you're limited to the choices that you can choose. So it's just kind of an FYI, so if you're not in an open enrollment, you have to look elsewhere.
Yeah.
So we have one more bonus question here that we had in there, and we said we were going to come back to this because this is almost like a tax-free savings account.
Yeah.
So we have, what's an HSA and an FSA, and what should I use? I told you it was alphabet soup.
It is alphabet soup. HSA stands for Health Savings Account, and then an FSA is a flexible spending account. So a little bit different. With a HSA, it's basically pre-tax savings for yourself, your family. Typically, it's deducted from your pay that you put into a health savings account. Typically, you get some funds in there from your employer, and that money can sit there. It can be used for healthcare expenses. It's also tax-free. And the biggest difference between one or the other is the HSA is yours to keep.
Yeah, so it carries on. So when he says tax-free, so it grows in there tax-free. You can
Yes.
actually have it as an investment, very similar to a
Correct.
tax-free savings account.
Yeah.
But you have to use it
Yeah.
as healthcare expense, or you can use it for retirement later on. You actually can even have your debit card issued, depending on
Yeah.
which provider you have, that you can just use it as a debit card
Just
when
like
you
a
go.
debit card.
Yeah,
Yeah.
like when you go to your appointments and you
Yeah.
need to pay, because a lot of times you have to pay on the spot.
Yeah, and a flexible spending account. It's also pre-tax, your deductions, and your employer provides funds for that as well. The biggest difference there is you have to use those funds within the calendar year.
Yeah,
Or you
use or
lose
lose
it.
it.
You
Use
use it
it.
or lose it, which
Yeah.
nobody wants to lose monies that are deducted from your paycheck or that are provided by your employer.
So it all depends on your cash flow situation, because I can see both circumstances working out for you.
Yeah.
And we've learned, like the first year when we moved here, we had some health issues, and we did not have enough money into the HSA. So, but now we're in a better situation, and it accumulates. And if you need a lump sum, it's there. It's like that money, that budget that we said that should be set aside. Well, that is key, because
Yeah.
it can grow tax free. So if you don't need it, you can invest it as well.
It is daunting when we first moved to the U.S. It was the unknown. You're come from Canada. You go to the doctor and you don't get a bill in the mail. So learning how the healthcare system works down here and how the insurances work takes some time. Be patient, be thorough, and read everything.
And you're not going to run to the doctor if you just have
No.
a sore hip or a sore throat. You really think twice before you actually go to the doctor here, because you know it's going to be a bill.
And you learn who you go see.
Yes.
You don't just go into the emerge, because that's the biggest bill you'll ever get.
Yes. Well, I mean, in Canada, you have your walk-in clinics,
Yeah.
and then you have your family doctor. You have their clinics. You have walk-in clinics. You have an on-call doctor at some of these clinics that you can just walk in anywhere.
Yeah.
Or you go to emergency. Here you have an urgent care, and then you have emergency, and then you have your family provider. So it works a little bit different, because you
Yep.
will get a bill when you are at that appointment, or you may receive it afterwards.
Yeah.
So hopefully this was very helpful and informative. You subscribe, notifications, put that on, because we're always trying to put out some new immigration information.
Yeah.
You can always look at take a visit to our website, and that's at brendabjackson.com. You'll find some information on there. Let this life be our best life.
Until next time, talk to you later from Life with the Jacksons.
Bye-bye.